All right. Well, I am so excited to welcome Dr. Rebecca Knackstedt to the podcast. She is a board certified plastic surgeon specializing in implant-based and microsurgical breast reconstruction. She is an assistant professor in plastic and reconstructive surgery at Duke University. What, like it's hard. She completed her MD PhD at Medical University of South Carolina, where her PhD thesis was focused on vitamin D and inflammation, which I have a lot of questions about. She pursued an integrated plastic surgery residency and microsurgery fellowship at Cleveland Clinic, in which she became certified in functional medicine. And I have a lot of questions about functional medicine, as I'm sure my listeners do. Her particular research interests are prehabilitation for breast cancer, particularly for women undergoing neoadjuvant chemotherapy. So Dr. Knackstedt, welcome to the podcast.
Thanks so much for having me. I'm really looking forward to our discussion.
You have quite the credentials. I would hire you in a second.
Oh, thanks.
If my listeners took away one thing from our conversation today, what would you want that to be?
I think the main takeaway would be that this should be a message of empowerment for patients. Having surgery can be so overwhelming and so scary, but just knowing that you can control your recovery and your outcomes just by doing some simple things before surgery should be really empowering and encouraging.
So let's talk about some of those things that people can do before surgery to improve their outcomes.
When I talk to my patients in clinic or when I talk on my Instagram page, I often liken preparing for surgery like preparing for a marathon. You can certainly run a marathon without any preparation, but it's going to be miserable. And similar with surgery, you can have surgery without any preparation, but if you invest a little bit before surgery, it's going to improve your recovery and decrease your chance of complications. And it's really some of the same things you do before a marathon. So it's going to be working on your physical health, your mental health, and your emotional well-being, and those all can impact your post-operative recovery.
That's fascinating. As someone who's about to undergo breast surgery myself, this is something I'm going to be taking notes on. So I haven't heard a lot about prehabilitation. So why are we not talking about that?
That is such a good question. The reason is that most of these topics like nutrition and sleep optimization, stress and anxiety management, as you know, we're not taught these in medical school. Mm-hmm. We're not taught them in surgical residency. So when patients go to their surgeon to discuss their surgical preparation and the surgical plan, those topics are not addressed by their surgeon. And most patients don't know that it's something that they can do before surgery to impact their outcomes.
So what are some practical things that people can do or some tangible things that you can do to improve your outcomes?
The biggest hitters are optimizing your nutrition, especially with protein intake. And the reason for that is that your body needs so much protein to heal, almost an amount that you can't eat unless you're taking a supplement. So I recommend things like protein supplementation. Resistance training before surgery, if you're able to do it, is so important to build your lean muscle mass, both to allow yourself to have that protein store to help heal after surgery, but also just to allow you to function after surgery. You're going to be uncomfortable. Maybe you're going to be on activity restrictions. So just thinking ahead of time what you need to prepare to allow your post-operative functionality to be more improved.
I love that. I actually just started drinking protein shakes. My husband is on a very high protein. He's doing macros, so he's doing 30% protein, 30% fat, and 30% carbs. He's lost a lot of weight and looks so much leaner. So I'm jumping on the bandwagon too. So I'm happy to hear that will help my surgery.
Yeah, and I think it's other things that we often don't discuss with our patients too. Things like the amount of sleep you get after surgery can actually impact how much pain you feel and how much narcotics you need. That's something that most patients aren't aware of, but we also know that so many aspects after surgery decrease your ability to sleep. Things like pain and anxiety. Maybe you have dressings that you have to wear after surgery that aren't very comfortable. So it's so many things that we don't think about, but it's really just looking at patients holistically and thinking about what they can work on before and after surgery.
I love that. And I'm sure that a lot of these lifestyle modifications will lower your risk of recurrence as well. Is that right?
Absolutely, especially when you talk about resistance training and exercise, healthy eating, anti-inflammatory diet, low in alcohol. All of those things are important for surgery, but also just your overall health and well-being.
Okay, so I'm glad you mentioned that, and I'm glad you have a specialty and subspecialty in functional medicine, because I think functional medicine, in theory, I think it's a great thing, right? Like, we want to look at the body more holistically. Inflammation, we know, is a big trigger of diseases, but sometimes I feel like on social media, especially, functional medicine is being used to propagate false misinformation. Tell me about that.
Yes.
Like, how do we?
Yes. Thank you for bringing that up. The challenge with functional medicine is that many different practitioners can become certified in functional medicine. So some people are MDs, PhDs, nurse practitioners, but some are acupuncturists or chiropractors who don't have the same foundational medical understanding that some of those more advanced degrees do. So they're still a functional medicine provider, but their base of foundation is just very different. So that's the first thing I think that's important to consider, or what are the credentials of the person that's giving the information. The second thing is that within conventional medicine, we love evidence. We love studies and literature and randomized control trials. And so many of the aspects of functional medicine are nearly impossible to do those high quality studies on, things like yoga, sleep. It's hard to do a blinded study on whether or not someone's getting Reiki therapy or aromatherapy. So the level of evidence for a lot of these topics is not wonderful. When I talk to patients about it, I always think about when you are ready to implement some type of intervention, whether it's a lifestyle or a medication, think about the risks and benefits. Something like music therapy is not really high risk, but it can relax people, decrease their anxiety, and if it works for you, that's wonderful. Versus something like chemotherapy that has a much more high risk profile, you want those high quality randomized control trials. So I think that's important to keep in mind too. And also see what the person who's promoting the information is selling. And if they're selling something, you got to take everything with a little grain of salt.
Okay, I'm so glad you mentioned that, because I mean, obviously there are even MDs that have kind of gone to the dark side of functional medicine, and spreading misinformation that mammograms cause cancer because radiation. Mammograms have radiation. Radiation is bad.
Yep.
So they're then trying to sell you either on a thermogram or QT
Exactly.
imaging.
Oh yes, absolutely. And I think that's the part that makes me most sad, and I'm sure you too, because you have someone who the general population thinks they can trust. They're an MD, they're trained, they've done these fellowship trainings, and then they go on social media spouting misinformation for personal gain, spreading fear. And as someone in the healthcare profession, it's just very, very disappointing.
What do we do about that? Like, what do we do about that as healthcare professionals and also as patients? Like, how can you tell when someone has your best interest at heart or not?
That's very challenging. I think that as healthcare professionals, it's kind of what you and I are doing today, using platforms like podcasts and social media to spread evidence-based information. And then I think for patients, it's just informing them what they should be on the lookout for. Like we just talked about. What is that person selling? What do they have to gain by you adopting their beliefs? And I think that if you do that, and then as always, ask for studies, ask for the level of evidence, and if they can't provide it, it's probably because it's not there.
I like that. And yeah, like you said, there's a place for evidence-based medicine. Getting a mammogram because you think it's going to cause cancer is fear mongering. And also we talk about low risk of music therapy. Well, this is a very high risk. By scaring someone away from getting their approved cancer screening tests, we're going to see more late stage cancer. And then the same people are going to tell you that chemotherapy doesn't kill the cancer, it causes you, and you could treat it with this diet.
Yep.
And it's a very slippery slope.
It's a super slippery slope. That's hard to say. But I think that the other disappointing thing is that for these people who are promoting a diet, they're almost always selling a book or a supplement or a masterclass that you have to pay for. But it also off puts a lot of people to the idea of that alternative therapy, which is lovely when you combine it with conventional medicine, things like an anti-inflammatory diet, but alone, it's evidence-based to not be as effective as the conventional treatments.
Yeah, so you are a proponent of some combination of the two,
Absolutely.
of conventional.
Absolutely.
Okay, that's good to hear. So as a plastic surgeon, what is your preferred type of breast cancer, of your breast reconstruction, for starters, for patients with breast cancer?
It is such an individual decision, and it's hard because patients ask me all the time, what would you do? And it's such a hard question to answer. I love doing direct to implant. I love implant-based reconstruction in the right person, but I also really love autologous reconstruction, using your own body, allowing that breast reconstruction to age with you. And I think it's an individual decision, both for the person and their oncologic characteristics, but also where they are in their stage of life. Some patients have young children at home. They have a demanding job. They can't take off that 6 to 8 weeks off work that a body-based reconstruction might take. So while it might not be a good option for them right now, it might be a great option 10 years from now, 15 years from now. So I think it's very important to know that breast reconstruction can be fluid and your preference can change over time, and important to remember that it's covered by insurance.
I love that. So you meant, so for anyone listening who is not familiar with what the autologous reconstruction, that's when you basically use your belly fat and they transfer it to reconstruct breast. Is that a good way to explain it?
It's a great way. I usually describe it as a self-transplant. So you're taking an area of your body that's expendable, belly, thighs, lower back, and you use that to make a breast.
And it's a much bigger surgery, so much more downtime. And you also
Absolutely.
need to have have to have a certain amount of belly fat or fat somewhere else that you could donate. Right?
Donate. Yes, exactly.
That's interesting. And then the third option, of course, is going flat, or an aesthetic flat closure, which is always an option. And we're seeing more people do that.
Absolutely. And I also offer, and many plastic surgeons offer, something called a Goldilocks, which is exactly like the name implies, but many patients don't know it's an option. And it's where we recycle what's left over after the mastectomy to create a small breast mound. But we're seeing a lot of patients opt for that too. They want a small breast. They're okay with being smaller than they are right now, but they're not interested in implant-based reconstruction or body-based reconstruction at this time.
Interesting. I like that. So it is some residual breast tissue of their own.
No, it's just skin and fat that's recycled.
Oh.
So it's a really great option in large-breasted women who, after the breast is removed, have a lot of residual skin and fat. And then we basically rearrange it like a Rubik's Cube and can create a small breast mound.
Interesting. Goldilocks. Ask about that. So what is your favorite type of reconstruction to do for someone who doesn't have breast cancer but wants some kind of lift, but doesn't want an implant, and this person being me?
I love that. Asking for a friend that is yourself.
Yeah,
that's perfect.
Right. Totally.
I really love, in patients who need a breast lift, but also want to look maybe fuller, more rejuvenated. I think that doing a breast lift with an auto augmentation and fat grafting, which is a lot of words, but it's basically lifting your breast, not removing any of the tissue, but using your own breast tissue to provide a little implant type of thing that it provides some upper pull fullness. And then fat grafting is lovely because it's a little bit of liposuction, which most patients really like. And you take the fat out, purify it, and you can inject it to create more volume, more upper pull fullness, and really add to that rejuvenation appearance.
I love that. So I saw a plastic surgeon this morning because for those who don't follow me on Instagram, if you've been following along, I had a biopsy of my right breast off a mammogram. It ended up being something called PASH, which is pseudoangiomatous stromal hyperplasia. I cannot not sing it now after my little song. But they're calling it discordant, and they're recommending I take the area out. And while I'm doing that, I do want to get some kind of lift, and it's time. I deserve it. I breastfed 3 kids, but I don't want an implant. So I originally had spoken to my surgeon about doing that. I think taking the lower pole and kind of flipping it to the top and making that kind of your own implant with your breast tissue. But then the surgeon I saw today didn't think I needed that. Is that common? Like, do you think that will be okay?
It depends on what your goals are. Some
Yeah.
patients after breastfeeding are completely volume deficient. I
Mm-hmm.
think for women who have breastfed and know what I'm talking about, they know what I'm talking about. And
Like
for those
deflated
women,
balloons, sorry.
yes, like a deflated balloon, exactly.
Right.
And so for those patients, the whole goal is to maintain as much volume as possible. So recycling the tissue
Mm-hmm.
versus if you do want to be a little bit smaller, then removing that lower pull of tissue that you would have otherwise kind of pulled up almost
Mm-hmm.
can be a good option. But fat grafting is another nice option too that can provide some upper pull fullness, a little bit of
Mm-hmm.
volume. And it all just depends on what your starting point is and what your ultimate goals are for size and volume distribution.
I may get a second opinion, and I always tell patients to consider doing that too, just because I agree. Like maybe I don't need the extra fullness on the top. I said I kind of want to be a perky bee, like that's what I feel like in my soul. But so I don't. I just want to make sure I can get that appearance with just a lift and not having to do the flipping the
I
pole.
love getting second opinions. And that might
Mm-hmm.
sound really weird from someone who needs patients to operate on, but I routinely tell my patients to get second opinions. And that's because there's so much art to plastic surgery. We do a
Mm-hmm.
lot of things based on science and based on literature, but a lot of it is how we were taught, what we grew up doing, and what we feel comfortable doing in our practices. And for so many patient scenarios, there are more than one or even two possible very good options. So I think that having a second opinion, if you have the luxury of time and it's not a cancer diagnosis that needs taken care of, absolutely get a second opinion.
Absolutely. And I think sometimes patients feel like they're going to offend their surgeon by getting a second opinion. We're not
Yes.
offended. Like this is
No,
doing our due diligence.
absolutely. Absolutely.
Yeah. Okay. Great. So, for those who don't follow you on Instagram, you have a great Instagram account called Surgical Recovery. So, tell me about your social media journey and why you decided to jump in.
Yeah, so when I started in practice and I wasn't busy, I had so much time. I could discuss things like lifestyle interventions before and after surgery. And then as I got busy, I no longer had that luxury of time to spend discussing those things with patients. So I needed an avenue that I could provide that information to patients. And so that's why I started my Instagram page. It wasn't really initially for my own patients. But then as I thought about it, as a practicing surgeon, I can only impact the patients that I meet in person and do surgery on. But through social media and podcasts, Instagram, YouTube, I can reach thousands of patients and spread evidence-based messages of empowerment. So that's why I started it. And I actually found that I really love it. I really love the creativity and meeting people and doing these podcasts. But it's really just spreading the message to patients who I never would have met otherwise.
Absolutely. I mean, that's been my experience is that like I have people from around the globe reaching out that they like my content and that if they found it particularly helpful, especially in their breast cancer journey. And that is like, you nailed it. Like we're helping so many more people that you would have never encountered in your 15 to 30-minute office visit.
Absolutely. And there's so many accounts on social media, like you were saying before, that are benefiting from spreading their information. And we need evidence-based accounts to counter that and provide a place for
Absolutely.
patients to find evidence-based information.
Absolutely. I read recently that about 50% of young people get their health information from social media, which is shocking, but not surprising. And I think that number
Exactly.
is going to increase,
Mm-hmm.
so I think that we really, actually, Dr. Vivek Murthy, the the Surgeon General of the US, made a big statement back in 2023 saying that health misinformation is one of the biggest public health threats and that he's encouraging more and more doctors to get online and provide evidence-based medicine so we could, combat all the misinformation that goes around online.
Yes, it sometimes feels like a never-ending battle.
Yeah, let's talk about that. As an evidence-based girly, what are some of the biggest things misinformation that you hear on social media?
There's so many to choose from. But I think
Yeah.
the one that is most upsetting to me as someone who takes care of breast cancer patients there are accounts on social media who will routinely say phrases like, all cancer is preventable. 90% of cancers are preventable. And those patients or those accounts are always selling something. But why that's so upsetting is that I have patients who come into clinic. They're 30 years old. They eat healthy. They exercise. They have a spiritual practice. They did all the right things and they still got cancer. And they want to know, what did I do wrong? What could I have done to prevent this? Why me? And they have these feelings of stress and anxiety and guilt even that are completely unfounded and also are so unnecessary and harmful during a period of time that is already so stressful and anxiety provoking. So that is one of the misinformation messages that I see on social media. I think that is so harmful and really upsetting.
Absolutely. And on that same note, since you cannot prevent breast cancer, you can do everything right and still develop it. This is why screening is so important. And for me, the biggest thing on social media, the biggest lie that is being told is that mammograms cause cancer. Yes, mammograms have a very small amount of radiation. It is necessary to detect the microcalcifications of DCIS or some early stage breast cancers. But the benefit is that we might find your breast cancer at an earlier, more treatable stage. You may be able to avoid chemotherapy, more aggressive lymph node dissection, and just better outcomes overall. So, I think that obviously everything is a risk benefit, weighing the risks and benefits, but all medical societies and the National Cancer Institute say that the benefits far outweigh any small risk from the radiation from a mammogram.
Absolutely. And that message, that lie, is all over social media, just being so widely propagated.
It's so harmful. And I think it's so, those voices are the loudest and they get the most it's clickbaity because you're like, have my doctors been lying to me the whole time? I jump in the comments and people are like, you're just trying to sell me a mammogram. And I was like, that's not actually how I get paid. Like, I will read whatever breast imaging study is appropriate. I would read QT imaging if I felt like it was appropriate. But that's not how it works. On the contrary, the person who is telling you that mammograms cause cancer is selling you something that is not approved to replace a mammogram and selling it as though it will be the replacement of mammography. And it's just not there yet. We need long-term studies, we need data, and we need to see how these patients are doing in 1 to 5 years. And all these people are paying out of pocket $600. They're being told to come back in 3 months, which is not even any conventional follow-up. And it's being sold a false sense of reassurance.
Absolutely. It's very similar to the message that I see on social media that medical oncologists make money by giving chemotherapy. Also very not true. It's not how we make our money. And it's, like you said, it puts that plants that seed of distrust in people's minds that they shouldn't trust their doctors.
It's really, it's scary out there.
It is scary.
Okay, so this was going to lead me to my fact or fiction breast cancer edition. We did cover lots of these. Bras cause breast cancer.
Oh gosh, yes. I have debunked this so many times on my page because once again, as a surgeon, I am placing my patients in a surgical bra after surgery. So let's discuss the evidence. There is none. There's actually well-done studies showing that bras, even under wires, do not cause cancer. The other part of this is that I see people saying that bras decrease lymphatic flow of your breast, and so you will get toxic buildup, which then leads to breast cancer. Also not true. As someone who did a microsurgery and lymphatic surgery fellowship and saw the lymphatic system, it is not true. And in fact, if someone has breast lymphedema, like after radiation, we treat it by using a compression bra.
Interesting. Love that. All right. What about deodorant causes breast cancer?
Yeah, this is a little bit more of a tricky one. So I think that first we need to talk about what is causing cancer. So like you said before, does it increase your risk for developing cancer? And there are studies showing that deodorant use does not cause cancer. But this is a little tricky because there's animal studies showing that if you give animals very high doses of aluminum, it can augment breast cancer growth. And people see this and they freak out about aluminum. But it's important to remember that that is not a dose of aluminum that we are getting through deodorant use. It's a way high levels. That's the first thing to think about. But there also are there was one human study, I think it was published a couple years ago, and it looked at patients who did develop cancer or didn't. There was 200 in each arm. And they asked them to recall how much deodorant they used in their 20s and 30s. So asking them to remember 20 years ago how much deodorant they used. And what they found is that patients who remembered using aluminum-based deodorants many times a day, which is hard to remember 20 years ago, did have an increased risk of developing breast cancer. That's a very flawed study because it's asking people to remember what they did 20 years ago. And then the second part of the study is they looked at the breast cancer specimens and found that they did have increased aluminum in them. But once again, this is a correlation versus causation. Definitely can't determine causation. It's simply just correlation. But I usually tell patients, there are studies showing that deodorant in and of itself does not cause cancer. But if you want to be very careful, choosing an aluminum-free option, a paraben-free option, because that can mimic estrogens, is a really great road to take. But I certainly do not think that we need to overall be concerned that deodorant causes breast cancer.
It's a great answer. Yeah. I was going to say, what type of deodorant do you use?
So I have tried all of the natural forms. I started when I was pregnant, and I have yet to find one that I really like. So if you or one of your listeners has one that they like, please let me know. But I just found that they aren't very effective. So I would love to know what you use or if you have any recommendations yourself.
I personally use male deodorant, like just regular, because I think it works. Well, one, I think that we talked about, it's a very small amount of aluminum. And I just feel like there's so many things in our environment that are probably causing our breast cancer, not the aluminum that I put in my deodorant. So
choose your battles. And I also really like a strong, nice deodorant for those long days in the OR. So
exactly. Yes. There you heard it here first. We're covering all the hot topics today. Is there anything that we did not talk about that you would like to mention?
No, I think that once again, we talked about so many important things today.
Yeah.
And as people are listening, as you're going on social media, just looking at the credentials of people that you're getting information for, looking at what they're selling, looking at what they're promoting, and just being very careful because there's so much misinformation out there. And then if you do have a surgery coming up for yourself or someone else, just knowing that there are things to do before surgery that can optimize your outcomes and recovery. This is what I address on my Instagram page. It's at surgical_recovery. But if anyone has any questions, I'm always happy to address them too.
I love that, Rebecca. Thank you so much for coming on my podcast. You're an excellent
guest. Thanks for having me.
Thank you.